Magnetic resonance imaging, also known as MRIs, is a medical imaging technique used to create detailed images of the organs and tissue in your body. This technique uses a magnetic field and computer-generated radio waves. The MRI machines are large tube-shaped magnetics, so the patient's whole body can fit in the machine. While inside the machine, the magnetic field will temporarily realign molecules in the patient's body. This is due to radio waves that affects the water molecules that produce faint signals, which helps with cross-sectional magnetic resonance imaging. While getting an MRI, ionized radiation is not used, which means there is no risk of exposure to radiation during an examination. MRIs are mainly used to look at the brain and spinal cord. This is done to help diagnose stroke, tumors, brain injury from trauma, and disorders of the eyes and inner ear. While trying to find the diagnosis of the brain and spinal cord, the radiologist-technologist will look at the blood flow to certain parts of the brain. Also can be used to make sure the right circular functions are functioning right. MRIs of the heart and blood vessels are used to look at the size functions of the heart chambers, the thickness and movement of the walls of the heart, the extent of damage caused by heart attacks or heart diseases, and to look at inflammation or blockage in the blood vessels. MRIs of the internal organs are used to check for tumors on the prostate, ovaries, uterus, pancreas, kidneys, and liver. It can also be used to look at the bones and joints to determine if there are any soft tissues or tumors in the bones. MRIs of the breast can help with mammography to help detect breast cancer, mainly in women who have dense breast tissues. Benefits of MRIs: it provides better soft tissue contrast than a CT scan would. It can help look between the fat, water, muscles, and other soft tissues than what a CT scan would. These images provide information to physicians and can be useful in diagnosing a wide variety of diseases and conditions. And the risk is that even though MRIs, you're not exposed to ionized radiation, you are still exposed to hazards that are in the MRI room and what is around the MRI imaging area.